This demonstration will show how your brain chemical levels change when you start to take drugs. Let's say, for example, you're taking a drug like cocaine. Cocaine affects the levels of dopamine in the brain. Under normal conditions, there's a set level of dopamine that your brain has within the normal range. If you start to take the drugs, the level of dopamine will increase in the brain, making you feel good. However, your brain will try to reset itself. It will either lower the levels of dopamine that it produces, or it will change the receptors on the dendrites of certain neurons to be less receptive to the dopamine. When this happens, even when taking drugs, you're only at the normal brain levels. If you stop taking the drugs, you'll start to feel pretty bad. If you want to feel good again, you'll have to increase the level of drugs that you take. This shows the buildup of tolerance. Again, the brain will reset itself. At this point, if you stop taking the drugs, you'll start to have withdrawal symptoms. The body can react in many different ways due to the lack of certain neurotransmitters in the brain. Again, the person would have to increase their dosage of the drug to feel good again. If at some point the person wants to go into a detoxification program, the normal levels of the brain will slowly reset. However, if at any point they decide to take drugs again, they're now at risk of overdosing because the difference between the drug levels and the normal levels are so extreme.